Okay, so I'm going to do my pre-exam environmental check. And to make sure that there's nothing on my screen. Okay. Alright, so I've already recorded the vital signs, which is the temperature, the pulse, the respirations, and the blood pressure. I have your height and weight recorded and your Snellen charts results as well. So now I'm going to assess your skin. I'm going to assess the color, the temperature, the vascularity, and the skin turgor. And then I'm going to assess your fingers and your nails. I'm going to look for the color, for any lesions, the shape of them, the angles of them. And we want to make sure that the capillary refill is less than 3 seconds. So there aren't any lesions, that's good. Alright, so now I'm going to inspect your hair. I'm going to inspect the texture of it, for any luster, any absence or excess of hair, the distribution of the hair. Now we're going to inspect the scalp. We want to make sure there are no lesions or any abnormalities. Now I'm going to palpate the skull. Okay, so now we're going to inspect your face. I'm going to look at your eyes, make sure that all of your facial features are symmetrical bilaterally. Your eyes are bilaterally symmetrical, your eyebrows, your ears, your palpebral fissures, your nasolabial folds. And now I'm going to palpate your face. We want to make sure that there aren't any lesions or any bumps or any masses to be worried about. We're going to palpate the frontal and maxillary sinuses. And then we're going to have you smile, puff out your cheeks, frown, okay, and show me your teeth. Alright, that is testing cranial nerve 5, which is the trigeminal nerve. No, cranial nerve 7, which is the facial nerve. And then I'm going to have you close your eyes. I'm going to take a cotton round and I'm going to touch it to your face. You just tell me when you feel it.
I feel it. I feel it. I feel it.
Okay, that is testing cranial nerve 5, which is the trigeminal nerve. So now I'm going to have you take a sip of your water. And I want you to lean your head back and let me watch you swallow. Okay, we're just making sure that it's, in a line, not abnormal. So now I'm just going to palpate your trachea. Okay, would you grab your water again? So I'm going to have you take a sip of your water. I'm going to palpate your thyroid, so lean your head to the right and swallow. Alright, now take another sip, lean your head to the right, or to the left and swallow. Okay, good. So now that I've palpated your thyroid, I'm going to palpate your carotid artery on both sides, just one at a time so that we don't make you pass out. Then we're going to palpate the temporal artery. Okay, so now I'm going to listen to it with the bell of my stethoscope. We're going to listen to see if we can hear any Brodies. So now we're going to check your lymphatics. So we have your preauricular, your postauricular, your retropharyngeal, your submandibular, your submental, your deep cervical chain, posterior cervical chain, and the superficial cervical chain, deep cervical chain, posterior cervical chain, and superficial cervical chain. Then we've got the supraclavicular and the infraclavicular. And now we're going to assess cranial nerve 11, which is the accessory nerve. So I'm going to have you push against my hand. And shrug your shoulders, please. Okay, so now we're going to go into the ears. So I'm going to inspect your ears, just make sure there are no lesions or anything. Note the piercings that you have. And now I'm going to palpate your auricle and your tragus. Is there any pain? Okay, so now I'm going to look into your ear. On your right ear, I'm going to pull up and back, and I'm going to look at your eardrum, and it is pearly gray, and the light reflex is at 5 o'clock. Then I'm going to look into your left ear, and the eardrum is pearly gray, and the light reflex is at about 7 o'clock. So now I'm going to do the Weber test. This is going to test bone conduction. So I'm going to hit this together, and then I'm going to put it on the top of your head, and I need you to tell me if you hear it equally in both ears, okay?
Yes.
Okay. So that is just testing bone conduction, and that's Weber test. But now we're going to do the Rene test, which is testing bone conduction and air conduction. So I'm going to hit this. I'm going to put it on your mastoid process, which is right back here, and then you're going to tell me when you stop hearing it, and then I'm going to put it in front of your ear, and you're going to tell me when you stop hearing that, which is the air conduction, and that should be twice as long as the bone conduction, okay?
Okay. Okay.
Okay, that was 2 and 4. Now I'm going to do it again.
Okay. Okay.
Okay, and that was 2 and 6, so good job. Now we're going to do the Romberg test, which is going to test cranial nerve 8, which is the vestibulocochlear one. So will you stand up? So we're going to do balance. So I'm going to have you hold your arms out and close your eyes. Now I'm going to have you pick up one foot, and now do the other. Okay? And all right, so now we're going to move into the nose. So you can sit down. Okay, so now I'm going to inspect your nose. I'm going to palpate it first. Okay, now we're going to look at it. We're going to inspect for turbinates and for a deviated septum. Okay, now we're going to check the patency of your nares. So I'm going to occlude this nostril, and I want you to smell, breathe in, yes. Occlude this one, breathe in. Okay, so your nares are patent. Now we're going to do the smell test, which is going to test the olfactory nerve, which is cranial nerve 1. So close your eyes. I'm going to occlude one nostril, and you need to tell me what you smell.
Cinnamon.
Okay. And I'm going to do the other. Okay. Tell me what you smell.
Vanilla.
All right, so now that we've done the inspecting the nose, we're going to move on to the mouth. So first, I will start by just inspecting your lips, and I'm looking to make sure that there's no lesions or any cracks or anything on your lips, to make sure that they're well hydrated. And then I'm going to palpate your lips. Okay. Okay. So now I'm going to assess your mouth. I'm going to have you open and say ah.
Ah.
And I'm just watching the rise and fall of your uvula and your tonsils. So now I'm going to I'm going to assess the color of your tongue and make sure there's nothing wrong with your tongue, no lesions or anything like that. I'm going to look at the mucosal membranes in your mouth. I'm going to look for cavities, your gums, any loose teeth, any missing teeth, any swelling. Then we're going to have you stick your tongue out. And now stick it up, down, side, side. Okay, and that is testing cranial nerve 12, which is your hypoglossal nerve. Okay, so then we would do your gag reflex, and we're not going to do that. And then we would do a taste test. So will you stick your tongue out? So we'll stick it out. Okay, so in the back right here would be your bitter taste buds, and then moving down, you would have your sour, your salty, and then your sweet on the tip of your tongue. And then on this side, you would have bitter, sour, sour, salty, sweet. Okay, so then we're going to move to the eyes. Okay, so first I'm just going to inspect your eyes. I'm going to look from the side, looking at the shape of your structures. Okay, and then I'm going to assess for perla, which means that your pupils are equal and that they're round and that they're reactive to light and then that they accommodate. So your pupils constrict with light, so that's good. Now they're equal and round as well. We're going to have you look in the distance, and I'm going to put my finger, and you're going to look at it, and that's going to be the accommodation. Look. Okay. Your pupils constricted, which means that they can accommodate. So now I'm going to look for the conjunctiva. Sorry. Okay. And now we're going to do the H test. We're going to test extraocular movement. So just look at my finger and follow the movements. Okay. All right, and that's testing cranial nerves 3, 4, and 6, which are the oculomotor, the trochlear, and the abducens. So now we're going to test for I'm going to put my hand on the bridge of your nose, and we're going to see if your eyes are direct and consensual. Okay, so that pupil is constricting. Both pupils are constricting. So now I'm going to shine this light on the bridge of your nose, and I should see the reflection equally in both eyes. And I do. So now we're going to do the visual acuity test. We already did the Snellen chart, which is the far away, but now we're going to do close up. So I'm going to have you read a couple sentences off of this for me.
Dear resident, now is the time to respond. The Census Bureau sent you several requests to complete your 2020 census questionnaire.
Okay. So that is testing your cranial nerve 2, which is your optic cranial nerve. So stand up for me now. Now we're going to test your, we're going to do the other thing that's testing cranial nerve 2, which is your fields, your visual fields. So I want you to cover this eye. Now tell me when you can see my hand. Look straight at me and tell me when you can see my hand.
I can see it. I can see it. I can see it.
Okay. Keep your hand right there.
I can see it. I can see it. I can see it.
Okay. Now switch eyes.
I can see it. I can see it. I can see it.
Okay. Now keep your hand right there.
I can see it. I can see it. I can see it.
Okay. All right. So, like I said, that's also testing cranial nerve 2. So now you can go ahead and sit back down. We're going to do the lungs. So I am going to need you to stand up. I'm sorry. So now I'm just going to be assessing your thorax. I'm going to look at the anterior, the lateral. Turn around for me. The posterior. Excuse me. So then I just want to measure your transverse ratio and your anterior posterior ratio. Your transverse should be twice as big as your anterior posterior, which it is. So now I'm just inspecting your thorax, just looking at it. And I'm going to go through and I'm going to palpate it. Okay, then I'm going to have you, I'm going to do the tactile fremitus. So when I place my hands on you, say 99.
99, 99, 99, 99.
Okay, now I'm going to check your expansion of your lungs. So I'm going to put my hands right here and I'm going to have you take a deep breath. Okay. So your lungs expanded symmetrically, they're working together. Now I'm going to percuss your thorax. Okay, so we're going to, your breath sound should be heard in the bronchial, vesicular, and then the vesicular on the posterior. On the anterior, we've got the tracheal, then the bronchial, bronchiovesicular, and then vesicular. And so now I'm going to listen. Okay, breathe for me. So now I'm going to have you, I'm going to do bronchophony, which whenever I place my stethoscope on your back, I want you to say 99 again.
99, 99, 99, 99, 99.
Okay. All right. So now we're going to move into the cardiac. So I'm going to have you lay down. So before I start, I'm just going to look at your chest, just looking to see if there's anything abnormal, if it's abnormally shaped or anything. And then I'm going to palpate to see if I can feel any thrills. Okay, so now I'm going to check all of your pulses. So we already did your temporal and your carotid. So now we're going to do your brachial. Okay. All right, then your radial. Okay. Now we're going to do your popliteal. And then we're going to do dorsalis pedis. And posterior tibial. Okay, now I'm going to mark the heart valves. So your aortic valve is going to be on the second intercostal space on the right sternal border. Then your pulmonic valve is going to be on the left sternal border at the second intercostal space. Then you're going to move down for Erb's point. It's at the third intercostal space on the left sternal border. And then moving down, the tricuspid valve is at the fourth intercostal space on the left sternal border. And the mitral valve is at the fifth intercostal space, the left sternal border at the mid-clavicular line. Okay, so now I'm going to listen to all the heart sounds. At the aortic and the pulmonic, the S2 sound should be louder than the S1 sounds. At the Erb's point, it should be equal. And at the tricuspid and the mitral valves, I should hear S1 louder than S2. So I'm going to go in first with my diaphragm, and then I'll listen with my bell. Okay, now with the bell. Okay, so now I'm going to inspect your abdomen. So I'm going to look for any pulsations or peristalsis. So now I'm going to divide your abdomen into 4 quadrants. So this is going to be the right upper quadrant, the left upper quadrant, left lower quadrant, and right lower quadrant. Okay, so now I'm going to listen for bowel sounds. So now I'm going to percuss the stomach or all over the abdomen. Okay, now we're going to percuss to see where the liver is. So we're going to see where it goes from tympany to dullness. Okay, then we're going to go from resonance to dullness. Okay, so then we're going to measure that. It should be 2 to 4 inches or 6 to 12 centimeters, and it is 1.5 inches. So now I'm going to lightly palpate the abdomen. I want to make sure that there are no masses. Now we're going to deeply palpate. Okay. So now we're going to palpate the liver. I'm going to have you take a deep breath in. Okay. Take a deep breath in. We're palpating for the spleen now. Okay, and I didn't feel anything, which is good. You don't want to feel them. So now I'm going to have you sit back up for me. And I'm going to move to the neurological. So we're going to make sure that we hit all of the cranial nerves. So cranial nerve 1 was the olfactory, and we did the smell test. Cranial nerve 2 is the optic, which we did with the visual acuity and the vision fields. Cranial nerve 3, 4, and 6, the oculomotor, trochlear, and the abducens, we did with the H test. Cranial nerve number 5, we did with the facial sensations. Cranial nerve number 7, we did when we tested when you smiled and puffed out your cheeks. Cranial nerve 8, vestibulocochlear, when you did the balance. Cranial nerve 9, the glossopharyngeal, when you did the taste test, cranial nerve 10, which is the vagus nerve, when you swallowed. And cranial nerve 11, the accessory, when we tested your head, your neck strength, and you showed your shoulders. And then cranial nerve 12, which is the hypoglossal, when we tested your tongue strength. So now I'm going to ask, what is your name?
Regina.
I'm going to ask, where are you?
My home.
And what day of the week is it?
Sunday.
Okay, so you're oriented times 3. Now I'm going to give you 3 words. We're going to test your recent memory. So we're going to do gray, cat, and bow. Okay, so now we're going to test your past memory. So what is your birthday?
7/25.
Okay, and your present memory. So who's our current president?
Donald Trump.
Okay, and we're going to test your ability to make judgments. So if you found a stamped envelope on the ground, what would you do with it?
Put it in the mail.
Okay, and now your abstract reasoning. So what would you say it means if I said it's raining cats and dogs?
It's raining really hard.
Okay, so now will you tell me those 3 words that I told you?
Gray, cat, bow.
Okay, and now we're going to test your musculoskeletal. So we're going to have you stand up. Okay, so I'm just going to start by inspecting you. I'm going to look at your joints, your posture, your gait. And so I saw your gait when you came in. I'm looking at your shoulders, your elbows, your wrists, your fingers, your hips, knees, ankles, and toes. Now I'm going to look at your spine. So if you can just face that way and bend over towards the ground. I'm going to test, I'm going to inspect for scoliosis, lordosis, kyphosis, and your range of motion in your back. All right, you can stand up. All right, now I'm going to palpate all of your joints. So your shoulders, your elbows, your wrist and fingers. Okay, and then your knees, your ankles, and your toes. Okay, so you can go ahead and sit back down for me. Now we're going to work them. So I'm going to ask you to raise your arms out, raise them, or do them in a circle, backwards circle, then raise them up to your head, above your head, back down, cross them. Okay, roll your wrist, wiggle your fingers. Okay, now pick your knee up, kick your leg out, put it back down, knee up, leg out, back down. Roll your ankles for me. Okay, next. And then wiggle your toes. Okay. now I'm going to test for stereogenesis. So I've got two objects, and I'm going to place one in one hand with your eyes closed, and you're going to tell me what it is, okay? Close your eyes. Okay, hold your right hand out. Tell me what it is.
Paperclip.
Okay, hold your left hand out.
Coin.
Okay, good. So now we're going to do the graphesthesia test. So hold your hands out. I'm going to write a letter in one and a number in the other, and you need to tell me what it is. So I'm going to do the number first.
Can you do that again?
Mm-hmm.
8.
Okay. Now the letter.
X.
Okay. So now we're going to do the point localization. So I'm going to touch a part of your body, and you're going to tell me what it is, okay?
Okay.
Close your eyes.
Forearm. Knee. Leg. Shoulder.
Okay. So that was all testing your sensory function. So now we're going to do the sharp dull, which also tests sensory function. So this is dull, and this is sharp. Okay?
Dull. Sharp. Sharp. Dull.
Okay? So now we're going to do your cerebellar function. So I assessed your gait when you walked in. We did Romberg test, which is where you did the balance. And now we're going to do tandem walking. So I'm going to have you stand up. I'm going to have you walk with your heel in front of your toe for 4 steps. And then back. Okay, you can sit back down. Now I'm going to have you do your upper extremities. So we're going to do pronation and supination. So I'm going to have you do like this. Now I'm going to have you do it quick. Okay, and now I'm going to have you do the lower extremities. So I want you to draw a figure 8 with your foot. Okay, other foot. Okay, good. So now we're going to do your deep tendon reflexes. So I'm going to have you relax right here. Okay. These are your triceps. Relax. Relax. Okay. Now we're going to do your bicep. Alright, now we're going to do your Brachioradialis. Okay. Okay, now scoot back for me. We're going to do the Patellar. Okay, now you need this to be raised a little bit. Okay. Okay. Now I need you to turn around and face the wall and put one of your legs up on the bed. Okay, we're going to test the Achilles. Okay, next foot. Okay. All right. And now I'm going to do the post-environmental check. And there's nothing on my screen.